Restless legs syndrome represents one of the most misunderstood and underdiagnosed neurological conditions affecting millions of people worldwide. This complex disorder, characterized by an irresistible urge to move the legs accompanied by uncomfortable sensations, has puzzled medical professionals and patients alike for centuries. The condition typically manifests during periods of rest or inactivity, creating a paradoxical situation where the body's natural inclination to relax becomes the very trigger for distressing symptoms. The hallmark symptoms of restless leg syndrome include an overwhelming compulsion to move the legs, often described as crawling, creeping, pulling, or tingling sensations deep within the leg muscles. These uncomfortable feelings typically worsen during evening hours and nighttime, making it extraordinarily difficult for sufferers to fall asleep or maintain quality sleep throughout the night. The sensations are usually bilateral, affecting both legs simultaneously, though they can occasionally manifest in one leg more prominently than the other. What makes this condition particularly challenging is that the discomfort is temporarily relieved by movement, leading patients to pace, stretch, or massage their legs repeatedly throughout the night. The exact cause of restless leg syndrome remains somewhat elusive, though researchers have identified several contributing factors. Primary restless leg syndrome appears to have a strong genetic component, with studies suggesting that approximately 40 to 60% of patients have a family history of the condition. Secondary restless leg syndrome, on the other hand, develops as a consequence of other underlying conditions or circumstances. Iron deficiency stands out as one of the most significant contributors to secondary restless leg syndrome, as iron plays a crucial role in dopamine production within the brain. Dopamine, a neurotransmitter responsible for controlling movement and mood, appears to be dysregulated in individuals with restless leg syndrome. Pregnancy represents another common trigger for restless leg syndrome, with symptoms often appearing during the third trimester and typically resolving after delivery. The hormonal changes, iron deficiency, and increased blood volume associated with pregnancy contribute to the development of these uncomfortable sensations. Chronic kidney disease patients frequently experience restless leg syndrome, particularly those undergoing dialysis treatment. The accumulation of toxins and electrolyte imbalances associated with kidney dysfunction can exacerbate the neurological symptoms characteristic of this condition. Certain medications have been identified as potential triggers or exacerbating factors for restless leg syndrome. Antidepressants, particularly selective serotonin reuptake inhibitors, can worsen symptoms in susceptible individuals. Antihistamines, commonly used for allergies and sleep aids, paradoxically can intensify restless leg syndrome symptoms. Antipsychotic medications and some anti-nausea drugs that block dopamine receptors can also contribute to the development or worsening of symptoms. The diagnosis of restless leg syndrome relies primarily on clinical assessment and patient history, as there are no specific laboratory tests or imaging studies that can definitively confirm the condition. Healthcare providers typically use established diagnostic criteria that include the presence of an urge to move the legs accompanied by uncomfortable sensations, symptoms that worsen during rest or inactivity, temporary relief with movement, and a circadian pattern with symptoms being more severe in the evening or nighttime hours. Treatment approaches for restless leg syndrome vary depending on the severity of symptoms and underlying causes. For mild cases, lifestyle modifications often provide significant relief. Regular exercise, particularly moderate aerobic activity and leg stretches, can help reduce symptom frequency and intensity. Establishing good sleep hygiene practices, including maintaining a consistent sleep schedule and creating a comfortable sleep environment, proves beneficial for many patients. Avoiding caffeine, alcohol, and nicotine, especially in the evening hours, can help minimize symptom severity. Iron supplementation represents a cornerstone of treatment for patients with documented iron deficiency or low normal iron stores. Studies have shown that restoring iron levels to optimal ranges can significantly reduce or eliminate symptoms in many patients. The target ferritin level for patients with restless leg syndrome is typically higher than standard reference ranges, often aiming for levels above 50 to 75 nanograms per milliliter. For more severe cases that do not respond adequately to lifestyle modifications and iron supplementation, pharmacological interventions become necessary. Dopamine agonists, such as pramipexole and ropinirole, represent first-line medications for moderate to severe restless leg syndrome. These medications work by stimulating dopamine receptors in the brain, helping to restore the balance of neurotransmitters involved in movement control. However, long-term use of dopamine agonists can sometimes lead to augmentation, a phenomenon where symptoms worsen or begin occurring earlier in the day. Alpha-2 delta ligands, including gabapentin and pregabalin, offer alternative treatment options with different mechanisms of action. These medications, originally developed for seizure disorders and neuropathic pain, have shown significant efficacy in treating restless leg syndrome. They work by modulating calcium channels in nerve cells, reducing the abnormal sensations characteristic of the condition. These medications are particularly useful for patients who experience augmentation with dopamine agonists or have concurrent neuropathic pain conditions. Opioid medications represent another treatment option for severe, refractory cases of restless leg syndrome. Low-dose opioids, such as oxycodone or methadone, can provide significant symptom relief for patients who have not responded to other treatments. However, the use of opioids requires careful consideration due to potential risks of dependence and tolerance, necessitating close monitoring by healthcare providers. The impact of restless leg syndrome extends far beyond the physical discomfort experienced by patients. The chronic sleep disruption associated with this condition can lead to significant daytime fatigue, impaired cognitive function, and reduced quality of life. Many patients report feeling frustrated and helpless as they struggle to explain their symptoms to family members, friends, and healthcare providers who may not fully understand the condition. The involuntary leg movements and need to get up frequently during the night can also strain relationships and create social isolation. Research into restless leg syndrome continues to evolve, with scientists exploring new therapeutic targets and treatment approaches. Genetic studies have identified several genes associated with increased risk of developing the condition, providing insights into the underlying pathophysiology. Advanced neuroimaging techniques are revealing changes in brain structure and function in patients with restless leg syndrome, particularly in areas involved in movement control and sensory processing. Understanding restless leg syndrome as a legitimate medical condition rather than a minor inconvenience is crucial for improving patient outcomes. Early recognition and appropriate treatment can significantly improve quality of life for individuals affected by this condition. Healthcare providers play a vital role in educating patients about the condition, exploring potential underlying causes, and developing comprehensive treatment plans tailored to individual needs. With proper diagnosis and management, most patients with restless leg syndrome can achieve substantial symptom relief and improved sleep quality, ultimately leading to better overall health and well-being.